My heart was always wanting to be a nurse, and it was my dad, literally a week before September school started, who said, you need to follow your passion. You have too many work years left to consider that you need to do what you love, and literally picked me up. We went down to Wayne State University and registered me for nursing school, and that's where it began. I chose nursing because I always felt I wanted to really make a difference in other people's lives. I felt I had the ability to reach out and take care of people and be there when they needed someone most. It just seemed like something that I was meant to do, and it was true. When I got out of nursing school, I actually wanted to go on a chronic vent unit. That was what I had wanted. I worked a year as a student nurse associate, so I was actually able to work throughout a hospital. I knew the areas that I really didn't want to go to, but at that time, we weren't in a nursing shortage, so there wasn't a position for me. So I went to the nephrology unit. It was a step-down unit at that time, and I found out I loved it. I mean, nephrology uses all of your nursing knowledge and skills in this very complex patient population. So why should nephrology nurses get involved in health policy? Pretty much our entire job, our role, everything we do in healthcare is in fact affected by health policy. That is in fact what drives our practice. From the state level, our Nurse Practice Acts, from the federal level, basically everything that we see going on today. So who do we want to make decisions for us? Because our elected officials really don't know anything about healthcare. We in fact are experts in the care of our patient, and we're expert educators. So who better to educate our representatives on what we need to take care of patients? I think all nurses advocate every single day when they take care of patients. It's something that's inherent to what we do with our patient care. When we take it to another level, then we're expanding that advocacy, and it may even be with your own organization. It may then be your community. It then may be the state level and even the federal level. The executive order from President Trump in 2018 was advancing the American Kidney Health Initiative, and that really put kidney disease back on the radar. And the movement really is to try and create an environment that all patients with end-stage kidney disease have the option to do home therapies or kidney transplant. The Health Policy Handbook, which is located on the ANNA website, very easy to find. It is an excellent way to begin because you can educate yourself. It covers all the legislative processes that you need. It provides sample letters that you need. Everything's there, one-stop shop. To get started at the state level, really you need to educate yourself. That Health Policy Handbook really is a good way to get the information. Start bringing information to you. Go and look up your State Nurse Practice Act, because that really tells you the confines of what you're able to do and what you're not to do. It addresses delegation, it addresses all those things related to your role. And also look up your State Board of Nursing. They frequently have newsletters, or you can, and again, bring that information to you. Sign up for their newsletters. Keep an eye on what the activities are, because they're a wealth of information, and that's a good way to start. The other thing that we worked on and continue to work on is resources for the health policy representatives at the chapter level, because we know that's where a lot of it's going to begin. So we completed a new orientation process for them so they have resources to grow in that role, and we're building on that now. We also created a new community on ANNA Connected. ANNA Connected is a great way to really enhance your membership experience. Join the communities that reflect your practice, but join the advocacy news and alerts, because that's where we're going to get discussions going on advocacy. The Health Policy Workshop is usually held every other year in the odd years. This is the first time that we've actually held it where we're not in Washington, D.C. We're not going to the Hill to make visits, because essentially that's not possible right now. So we reframeworked it a little bit to take the opportunity to do a little more education on some of those things that matter, our payment practices that are being driven, that are a constant work and every year get updated, the quality measures that we work on every single year to try and really look at measures that matter for our patients. And who better than nursing to identify what those measures really are. I believe the future of A&A with health policy and advocacy is to continue to build on the foundation that we now have. We're going to continue to build on the resources for members and our resources for our health policy representative, again, starting at that ground level so that we can spread the advocacy word. I think we're also going to strive very hard to make sure nursing, nephrology nursing, is at the table for those discussions that are important to us. And we're going to continue to build on our collaborations. If we don't step forward to lead, others will be leading for us and telling us what our practice really should be. They'll be telling us what are the priorities for our patient. What should we be measuring? How do we determine how we improve our patient care? And is that what we really want to happen when they really don't know what nurses really do? We are experts. We need to use that power.